We see a lot of patients in our profession who unfortunately have worn dentures for a long period of time, and a lot of times people believe that that's just kind of going to be it. You know, they have to live with these sore teeth, they have to live with their gums hurting, they have to just consent to the fact that they can't eat things like they used to. That's really not true. You know, we can help people with dental implant technology. We can place as simple as 2 implants in someone's lower jaw and be able to attach those implants either to their existing denture if it's in good shape, or to a new denture that their dentist would make for them. But those implants would be secured to the denture, and the ability for the patient's mouth and the teeth to be more comfortable is greatly enhanced. What people will tell us is how much better they eat, how they don't have denture sore spots anymore. They don't use those glues, those great adhesives that are on the market that people can't, they hate having to wear those. A lot of people don't understand they don't have to do that. A really good example is we'll do implants for someone's upper jaw where you traditionally wear a lot of glue and a lot of adhesive, and their entire palate's covered. And one of the biggest complaints people have is they can't taste food anymore. When your whole palate's covered with plastic, everything tastes the same. So with implant overdentures, you can place, usually in the upper you have to place about 4 implants, but you can put enough implants in where they can just have a little U-shaped bridge. It's still a removable type of appliance, but that appliance can be placed into those 4 implants, secured. They no longer have to wear adhesives. The patient begins to chew more effectively. They speak better. They don't hear their teeth clicking like some people complain when they talk. They hear their teeth knocking together. You lose all that instability and you increase your ability to eat well. And probably some of the best people that kind of reap the rewards of that type of treatment are people that are diabetic and people that have like Sjogren's syndrome and other syndromes where their mouth is really dry. One of the things that implants will do for somebody is it doesn't let that denture rub on their gums anymore. So for people who have dry mouths and dentures, it's a miserable life. But if they have implants that hold them in place, all of a sudden they have all those sore spots go away and they find themselves eating better. A diabetic patient, if they eat better, a diabetic patient is going to be healthier because they're eating a better quality of food, because most people that wear dentures eat a lot of carbohydrates and things that are easier to eat but not always good for you. So if we can get people to have overdentures, or what we call implant-supported prosthesis, which means you can have a removable type of condition where you can still remove your teeth, because a lot of people still like that idea. They can remove them but yet have the security of those implants will keep them in place, allow them to talk better, they'll feel better about themselves, because when your teeth are in the right spot, you actually look different, you look younger, and your facial tone actually improves. So I've had some people say, boy, I never realized how old I looked because my teeth were all worn down, and now that you restore their mouth, they really have a more youthful smile, and that's a really rewarding part of that treatment. So for people who have really struggled with dentures or find themselves wearing adhesives just to keep their dentures in place, I think we may have an answer for you, and implant overdentures may be an option.